how are you doing? Welcome to our show. I am Dr. Nyamurungi Tumsime. I am a medical practitioner at TMR International Nalia. So we're going to have a discussion about the breast, everything you need to know about the breast. So I have my colleagues that are going to introduce themselves.
I'm Dr. Naukera Swalharenzaho. I work with Children's Clinic Nalia, and my colleague can introduce himself.
Thank you. I'm Dr. Kunsa Hudson Dimitrios. I work with Holy Cross Orthodox Hospital in Namungona.
So today we are going to discuss everything, okay, not everything, but a brief about the breast and what you need to know. So first of all, to begin with, what is the breast and what is a normal breast? Maybe Dr. Kunsa can start for us.
Thank you, Dr. Nyamurungi. Yeah, a breast is it's like a tissue we find more prominent in women, and a normal breast is found on the anterior chest, and the primary purpose of the breast is to do nutrition to the baby that is birthed by the mother. And normally this breast, it's usually, they are supposed to be two. So that means we have some abnormalities where you find someone has more than two breasts, and usually the breast can have a slight difference in the sizes between the right and the left, and it's usually a breast should also have only one nipple. The breast, when you feel it at home, a breast should be having some bit of lumps in, like the normal lobules in it, that are a bit soft and painful. And if you're not breastfeeding, a normal breast should not really be discharging anything from the nipple. So basically that is what I can say about the breast. Yeah.
Dr. Renzaho, do you have anything to add?
Well, yeah, like he said, for normal breasts, both in males and females, there are supposed to be two on the anterior chest, and the abnormalities talked about, that if you can see breast tissue and especially nipples anywhere else on your body, that is usually an anomaly, an abnormality. And usually it's also coupled with other abnormalities that you'll find in the body. So you need to take care of that and go and do a general medical checkup, which might actually be good for you in the long run, especially when you're a woman of childbearing age. Yeah, maybe another thing that he talked about, that usually when we look at the cycle of a woman, one thing that you should know, that yes, ideally the breast is supposed to be non-painful and non-tender. However, when it comes to women, usually in the cycle there, you will see that there are some days, especially the days towards your menstruation, that the breasts are going to be engorged, slightly tender, and if they are very tender and very engorged, you need to go and seek health care at a hospital, because that's usually not a normal sign, because there's supposed to be a threshold for pain and a threshold for engorgement. Yeah, maybe that's what I can say. And for men, their breast tissue is usually very minimal, and they don't usually have lumps in their breasts. Yes, so when you feel lumps in your breast, that is an abnormality for a man. Yeah, and you should actually seek health care. You go to a healthcare professional, explain what you felt, and then you seek medical help.
Very true.
Yeah.
So we're talking about a normal breast.
Yeah.
Take us through what an abnormality is supposed to look like. If someone has an abnormal breast, or if there's a disorder that is going on there.
Yes.
What are the signs? What are the things that patients are supposed to look out for and say, okay, now I think something is not okay,
Yes.
and I'm supposed to go and talk to someone?
Okay. So first and foremost, we should put it in habit to regularly check our breasts. Number one, you can actually catch a disease early, and you're actually treated earlier, and you have a very good prognosis. And then basically there are very many signs of abnormality in the breast. The first thing that people usually acknowledge or find out is, oh, my breasts are actually hurting. Now when they're hurting, they touch them, and when you touch them, you feel lumps. It doesn't matter if it is a pea-size feeling of a lump, that is an abnormality. most cases. You can also have discharge from the nipple. You're not supposed to have discharge from the nipple unless you are breastfeeding, and the discharge from the nipple is ideally supposed to be milk when you're breastfeeding. Then you shall look at yourself in the mirror. Like I said, you should make it a habit to look at yourself in the mirror and look at your breasts. You will see that there is a, breasts are actually unequal. But if you see that one breast is larger than the other, more than it usually is, you should actually seek medical help. Then if you look at the contour is basically, it's supposed to be smooth, but when you see that it's lumpy, even before you touch it, you should actually go and seek medical help. Then also the shape matters. If you see that this is not the shape that I usually have, for example, a lady who hasn't yet given birth, because when you give birth or when you go through pregnancy, sometimes it changes the elasticity of the breast, even breastfeeding. But if you are of childbearing age, but you have not breastfed before, and you see that there is change in your breast, you need to go and actually seek medical help. Sure. Yes. Then the signs and symptoms I'm talking about are for what we call the non-cancerous breast diseases. Now, when it comes to cancerous breast diseases, there are other things that you need to look out for. For example, you see your breast and you press on it, or even if you don't press on it, you see some discharge. This discharge is usually colorless and most cases bloody. Yes, you need to look out for that. Then you also see reddening of the breast. You see reddening of the nipple. You feel lumps, and this lump is usually not movable most cases. It's usually in one place. If you see other symptoms, so when you talk about cancerous breast diseases, usually these cancerous breast diseases spread because of the anatomy of the chest. So some of the cancerous tissue can actually move through vessels, the vessels that we call lymph we call the lymphatics, yes. Vessels. So they spread the cancerous tissue and it goes into the armpits. So when you're examining yourself, like doctor is going to talk about, you will actually feel that there is a mass in my armpit, a mass that is hard and painless. So those are also examples of abnormalities or signs and symptoms to show that you actually have a breast disease. Then if the cancer has actually spread into the chest wall and gone into the lungs, you might actually start experiencing things like difficulty in breathing, coughing, sputum that has blood. You will see changes in your weight. You will see changes in your appetite. You will also get some symptoms which we call B symptoms. For example, you get some slight fevers. Basically, your mode of life has completely changed. Yeah, so you should actually look out for these things and actually seek medical help. Yeah,
very true.
So.
Very true. I agree with that. Actually, I think also in addition to that, we need to also remember that there are some times when people will experience changes that are not even, they're kind of off the ordinary. For example, you find some women who begin to lactate or release breast milk when they're not even having a baby, they're not breastfeeding, that nothing is going on. So normally that we tend to look into some other types of cancers that produce the hormone that is proper for breast milk production.
Exactly.
And I think all these things, like you've been saying, we tend to have these symptoms. They're not the same for everybody.
They're not.
Some people even you can find, they have like, I've seen some patients who come and they actually have lymph nodes that are painful. Some people you find there's nothing completely. Some people you find you have to continually screen. And this is the purpose of the exhibition. And this is the purpose of the medical personnel. So that we have these things checked early. That's all. Yes. Dr. Hudson, what else do you have to add?
It's very important to note of all the symptoms that Doctor mentioned. It's very important to note that a number of mothers or women would come to you with no symptoms, and it's very important to do the screening, because if not all of them will come with symptoms. In the early stage, some would come with no symptoms. So if you forego them, the disease can also progress. So also asymptomatic women can be screened for breast.
Screening is generally important.
It is.
Yeah. So Dr. Kunsa, we talked about men having breast tissue, right? What do we know about that? What are the anomalies? Can men get breast cancer? And then what do we know about that? Yes.
Okay. Thank you, Dr. Nyamurungi. Yeah, it is something that we need to clarify about And when you look at, most people might think that breast cancer is strictly for women, but also men can get breast cancer. And most cases that we find, it's a bit rare. For every 100 women that will get breast cancer, you will only find one male, like one male. So you find that also men, it's around 1%. Yeah, so you find like male can also get breast cancer, and because they have breast tissue there. So this breast tissue is also capable of transforming into cancerous state, and then they get cancer. So the answer is yes, men can also get breast cancer. To make more clarity on that, usually men, they get worse type of breast cancers because the metastasis and the breast tissue is minimal, so the cancer can easily spread and go to the other vital organs in the body and causes more.
We're talking about aggressive in the men, talking about different disorders. Maybe if Dr. Renzaho can tell us, what are the common diseases or disorders that we see in the breasts? What are the common situations that we see? What have you experienced? What have you seen? Things like that.
Okay. So in my experience, we usually divide them into the non-cancerous diseases and the cancerous diseases. For the non-cancerous diseases, I do not want to go into medical jargon so much, but you will find that we have diseases of the nipple, we have the disease of the breast as a whole, which we call mastitis, and it's usually in breastfeeding mothers. You see the breast is very engorged, very warm. These are usually signs of mastitis. We can even have abscesses form in breastfeeding mothers, whereby the sac that is supposed to be storing milk for the baby gets infected with the bacteria, and then the milk actually gets stagnated and then forms pus and then forms an abscess. Yes, so when that happens to you as a mother, you need to go and seek medical help. Yes, another disease is what we call fat necrosis. Fat necrosis is basically the fat tissue that is made up of your breast starts dying off. Yes, and this usually causes a lot of pain in women. And whenever you get such symptoms, you need to go to the hospital, they diagnose you, and then they treat you accordingly. Those are some of the examples that I can give. And also, women can also get cysts in their breasts. Yeah, that is why it's very good to always go for screening, general checkups at least once every 6 months, especially for women. Yeah, mammographs should be given for mammographs should be done for women of childbearing age. As long as you have breast tissue, you need to go and they do what? And they check you. Actually, mammograms, ultrasound scans of the breasts. Yeah, and maybe when we go to some of the common diseases of the breast that are cancerous, we have cancer affecting each and every part of the breast. So I'm not going to make it so medical jargony, so I can say that every part of the breast can get cancer. The sac that keeps the milk can get cancer. The tubes that bring the milk from the sac to the nipple can get cancer. The nipple itself can get cancer. The muscle that makes up the breast can get cancer. So every single part of the cell of the breast can get cancer. And that is how we usually group them. So the doctor themselves, they will know that, okay, this has affected the nipple, can call it Paget disease of the nipple. Maybe this has affected the duct. Maybe we can call it infiltrative cancer of the duct. Then there are also some cancers that actually do not spread. We call them carcinomas in situ. So also those ones happen. Yeah, so the prognosis for this is actually usually good. So the earlier the detection, the better your prognosis, the earlier you can be treated and managed. Cancers of the breast can actually cure. We should remove this notion from our brains that cancer doesn't cure. Once they catch it early, they can actually treat you and manage you. Yes, the management can be aggressive, but they actually can be managed. Do not lose hope. Yes, that's what I urge people to do.
Sure.
Yeah.
True that. I think in addition to that, I think we also need to remember that we have like young girls.
Yeah.
Childbearing age. This is the age whereby your hormones are all over the place.
Exactly.
As in, you're menstruating today, tomorrow you're ovulating, tomorrow you get it. So even the same way the moods change, also the same way the hormones will also affect the rest of the body.
Exactly.
So you can experience young girls, like secondary school, high school, very many patients come in, and you find they have these masses, like call them the fibroadenomas, though that is not necessary information, but these are masses that normally have a relation with the hormones. So even in pregnant women, you find they tend to have these lumps and masses. So people who have hormonal imbalances. So I think these are things that we need to always remember. If you feel anything that is abnormal, speaking of feeling, Dr. Hudson is going to show us how to examine the breast, right? And then also, how often do we screen? How often do we screen? What are the screening modalities? Does everyone go through the same channel of screening, right? Yeah, and then I think we shall end with showing us how the whole thing is done,
How
right?
to self-examine at home. Very important.
Yeah. So please tell us, how often do we screen? What are the methods that we use? Does everything apply to everyone? So yeah, please go ahead.
Thank you, doctor. Yeah, about the screening, because we talked about all these cancers and the different diseases that the breast can get. So we need to know how to pick them up. So when you look at the breast, you can have a number of, first, like we can start with teaching our women on how to do self-breast examination. And a proper self-breast examination can be able to pick out a lot of these things. The way doctor mentioned that if these conditions are picked up early, it's very possible to treat them, and it usually improves survival. You can get total cure. Sometimes like you even improve the 5 years, you surpass the 5-year survival rate of breast cancer. So when you look at, when we look at self-breast examination, it is something that any woman, even a male, can do at home. Yeah, and girls, yeah, especially the girls, like you need to do this examination like at home, like with the mirror.
Schools teach them, right? I remember my high
Yeah.
school used to teach how to do them. Did your high school teach you?
No, it didn't.
Yeah, that's true. Yeah. Yeah. So thank you. Now, like when a woman, like as soon as like you have the breast tissue prominent, like you're supposed to examine at least once every month. The importance of examining it once every month, it will give you the baseline. You will know that this is the normal of my breast. So whenever anything comes up, you can easily tell. Yeah, you're the first to know. And the way we've said that, it's known that the breast is completely soft. There are some tissues there which are hard that you might feel. So if you're doing the examination regularly in the right way that we're going to teach you and demonstrate, you can easily pick up these abnormalities early enough. Yeah, so when you're at home and you have a mirror, the first thing is to stand in front of the mirror with your breasts all exposed. And then after standing, you look at the entire breast tissue. Try to first look at it. Is it the same size? We say that they have a difference in size, but this difference is not so significant. So you look at them, compare the sizes, look at the contour, the way doctor talked about. They're supposed to be smooth. Is it lumpy? Look at the nipple. Is it normal? Is it retracted? Does it have any discharge? Like try to stretch your hand up, and then yeah, you do that.
Or this.
Flexing your pec muscle.
Your pec muscles, so that you try to make the breasts move. So there you're trying to see, do they move okay? You can stretch them like this, then you see around a certain area there is maybe a mass. Then after trying to look at all those things, what you've mentioned, then you go to the step of trying to touch and feel. Yeah, you touch and feel. So as you're touching, it's very important to touch in a logical manner such that you don't miss any point or any part in the breast. So we can start with the nipple. You can go to the nipple because the nipple is a bit hard. So if you start to the nipple, you know the normal hard. So anything that you'll feel that is like the nipple or more than the nipple or something that you'd feel it's abnormal, you can go on to take it to the doctor and they do further.
I feel like this thing needs more description. People are not going to get it. Should I touch myself as you describe?
Yeah. It's, if you touch yourself, it's okay.
So we first of all do this, right?
Uh-huh.
Meanwhile, your breast, there's no bra. Of course, definitely. You're in front of the mirror, not so. So you're stretched out like this. You're looking at your breasts in the mirror, because you're not going to look like this. When you do like this, then you can't visualize well from up, not so. So you're saying we look into the mirror, and then we look at them, not so. Then that's when we look for the smoothness, any discharge, the nipple, the size,
contour.
Very true. Then from there we start to touch and feel, right? So we can begin from out going in. All we need to do is make sure we don't miss any spaces, not so. Please proceed as I show the people what we're doing.
So you can choose to start from out.
Going in.
So as you start from out, you go in a circular motion,
Like this.
like you try to go around the breast
like
up to where you started from, trying to feel. Then at the same time, you come on. You try to come while trying to narrow in
Come inside.
towards the nipple. Then you're trying to palpate to feel, do I feel anything, any mass? Is it painful? Does it run? Is it fixed? Can I move it? Something like that.
Up to the nipple.
Up to the
which
nipple.
is the center.
The center.
Then
Then it's very important to also go to the sides of the armpits so that you don't forget, because that's also part of the breast.
definitely.
Yeah, so you also palpate it and feel if there is any swelling. Yeah.
So when we're going to the armpit, are we going to everywhere? Just like so, because I'm
tail of the
describing, so we need to.
Yeah.
So we're coming like this.
Yeah, so when you do this, you see like your breast will go like this.
Yeah.
So it's called the tail of the breast. So you try to follow it, trying to palpate, and you feel. So if there is anything suspicious, you note it.
To the real
Then
center of the armpit.
the armpit
In the middle.
in the middle.
The groups of the
Yeah.
lymph nodes.
Yeah. So when you reach the armpit, you can examine those groups, the ones in the anterior side, posterior. Yeah. Yeah, so basically in the armpits, you're trying to look for any swelling there. Yeah. So that is the self. So this self breast examination should be done monthly, and the timing is very important, because when you're examining this breast, like you should do it within the 10 days from the start of your menstruation. Yeah. So once you do it between that, the breast is at its normal. It's not being influenced by the multiple hormones. So you'll be able to pick up anything that could be abnormal. Yes.
So people hear about mammograms, and they hear about scans, and they hear about the self-testing and the whatnot. When stroke who uses a mammogram, when stroke who uses a scan, you get me? And when, so we talk about the screening, what on said, as often as possible. As frequently as you look into a mirror, look at your boobs, not so. So a mammogram, who uses it or who qualifies, which patients, and then for a scan, which patients?
About the mammogram and the ultrasound scan or the scan, these are all a continuation of a screening. Actually, what we didn't clarify about, if you're at home and you get anything suspicious, the next part should be you take it to your doctor. So your doctor will take some history, and then the doctor will also do his examination, and then after that he can proceed to go to the other screening modalities. So one of them we talked about the mammogram and the ultrasound scan. Yeah, so with the mammogram, it's usually like, in simple terms, we would call it the X-ray of the breast. So the mammogram uses those X-ray to take the pictures of your breast to check for any abnormality or any mass. And it's usually recommended that the mammogram should be done after age of 40 years and above, 45 and above. That is according to the World Health Organization. Yeah, because when you use the mammogram, it takes pictures and it detects these abnormality or the masses which appear white in nature. And because when you're still young, the breast is still thick, having dense tissues. So if you take the X-ray, it will be a lot of density that can easily interfere and with the slices and cause the abnormality to disappear with the density. Yeah, so in that case, that means the young girls below 40, the women below 40, Sorry.
I know young girls. Anyway, yeah.
Yeah. Okay, all women are young, so the young women below 40, so it's recommended that you do the ultrasound scan. The ultrasound scan has advantages, like if, let me say, the breasts, we have variation in the breast, like you find a woman has smaller breasts, so those smaller breasts, they usually prefer ultrasound scan. And also, if you're going to screen a male, it's better you use the ultrasound scan to screen for those masses that you've seen. And then, like, if your client is still young and the breast tissue is still dense, it's also better to use the what? The ultrasound scan, because it can easily pick up the masses without any interference of the density, because of the different principles that it uses to get these images.
So if you find a woman who is like 50, but she has never delivered, or her breast tissue is dense, like it's firm. So here, are we going for a mammogram or are we going for a scan? What are your thoughts? She's an older woman, but her breasts are dense. You know, because people have different sizes of breasts.
Yeah.
The smaller the breast, the easier it gets undense, or the easier it gets pendulous, right? Or not pendulous in the wrong word. The smaller the breast, the less tissue that is in it, right? So therefore, you can find someone who is younger and they have a less dense breast, or someone who's older and they have a denser breast. In this case, are we using the edge or are we using the density?
I think we use the density to determine which type of screening we can do. For example, like you said, a 40-year-old woman, she's hasn't given birth before, the breast is non-pendulous, the breast tissue is firm. Well, of course, the first line you would use for screening is an ultrasound. Yeah, an ultrasound scan for the breast. And then if you need more clarification of maybe the disease, you could maybe do a mammogram. Yes, but the first line, ultrasound scan.
Definitely. So I think we're coming to the end of the show. Do we have anyone else? Do you have anything you want to add? Anything, a fun fact, something maybe you found that in your patient, something interesting about the boobs? I can tell you, I remember actually there's some interesting things, like how the babies can have breast tissue, like the newborns, or you find them lactating, or you find a newborn menstruating. So normally these are things that will tend to cause alarm in patients.
Very true.
Then they come, but of course you should be alarmed because you're a patient. This is something you don't have. But just to put your heart at rest, is that the maternal hormones, when you're pregnant and everything, they can pass into via the placenta to the babies. The baby will begin to experience things that you also experience. So the baby can get some breast tissue, and it's so most times people will worry, especially when they are boys. And you know, there are some funny traditional practices where they begin to cut these things. So
please don't do that, guys.
Please, man. That's why we are having things like the expo, so people can be educated, and these shows, right?
Yes.
So things like when you see your child menstruating, or you see the girl is bleeding, and she's a newborn,
she's a new
young.
baby.
Of course, go to a facility, go to hospital, and get it checked out. But just saying that sometimes these things, they do happen.
They do happen.
Do not be alarmed. Or even when you find men who have breast tissue, we call that gynecomastia.
Yeah.
Like we said, also the breast tissue in men, so the sizes can vary. Some people can have their hormonal issues that are going on there. So yeah, do you have anything else to add?
Actually, on the part of lactating neonates, please, mothers, do not press the breast and try to express milk from it. It will regress on its own. As the hormones fluctuate and, reduce and go down, the breast tissue will reduce and even the lactation will stop. The same thing with the menstruation. Don't go out panicking, going to very shady medical clinics there.
Doctor these days,
Yeah, everyone, you know, the village saying that kind of thing. It's actually normal. And as the hormones go down, so will the symptoms.
True.
Yeah, and just take heart, be patient.
Sure.
Yeah.
Dr. Konse, do you have any?
Yeah, just since we're talking about the breast, it is very important to know some of the things that would be protective from some of these breast conditions. Like we find that if a mother has, if you get children, if you give birth to children, it has a protective effect on the cancer. And you also find like if a mother is breastfeeding, it sometimes can be protective towards conditions like mastitis. Yeah, and we have like a number of things like if you're able to manage your weight, your diet, like these are all lifestyle that can be protective to some of the conditions that can attack the breasts.
You know,
So,
you said something and I remembered.
Yeah.
Guys, they talk about men. There was some minister, I don't know what it was, who was encouraging people, men, to suckle women's breasts. That it's going to reduce breast cancer. Guys, what are we saying about that? Like, does the men suckling the women's breast actually help? Is it of a medical benefit? What do we say about that?
Well, I have to read that research, doctor. Like the research made on that topic.
On that topic.
Because what are they sucking? Just stimulating the nipple and influx of dopamine and serotonin and, you know, these love hormones. Is it maybe because of the influx of these hormones, does it have anything to play in preventing breast cancer?
Now that information, that's what we want to. That's what the herbalists are telling our patients.
So more because like when we are putting our statements based on data, research, science is data-based. You know what has been researched and what is true, what has been found. Yeah. So what has been proven. Yeah. So I think
we need to find out.
Yeah.
Yeah. I've also heard the same statement about men that should really actually suckle their women's breasts and but we've not really had any data that proves that it's protective.
True.
But
if people have data that you know about, please share with us, right? Please share that information.
Yes, and then another thing, I don't know, another practice that is very controversial is there is an influx of men who I'm hearing in certain regions in Uganda who actually breastfeed from the teat of their women.
You know, I was going to say that.
Yes.
People do these things.
Yes, they do. I don't know if it's a fetish or something of the sort. But you see the normal flora in your mouth, okay, the bacteria in the mouth of the man and the bacteria in the mouth of the baby, maybe it's not overgrown in them and it's overgrown in you and you're sucking on the same teat, finishing the child's milk, basically.
Do you know, actually, on the same topic, by the way, I had one time there was a patient that I had somewhere where I was practicing. This man, you people, the child was malnourished.
Yes.
So we came to hospital and we're like, why is this newborn? The newborn was like 2 months. We're like, why is this newborn child? Why is this child not thriving? You know, only to get to find out. So we asked the lady, you know how you talk to the person and you're like, what's happening and everything? Is the child feeding? Well, she's like, yes, the baby latches, the baby suckles and everything. To go and find out. At least then the husband taking the breast milk. And you know the man has a strong jaw.
Yeah, so he pulls everything out and leaves nothing for the child in that moment.
Because the child will just do like this and pick, but the man will grasp and on one pulling, he pulls the entire liter. So by the time the kid comes, the child is malnourished. Men, please don't drink the children's milk. Don't drink children's milk.
Yeah, honestly.
Yeah. So
and maybe another thing I should add is about the breastfeeding mothers. Yeah, you should take note of the color of the milk that's coming out. Of course, the color of the milk changes as months go by because it starts with colostrum that's a bit clear-ish, more yellow, and which is very, very important for the child. Please do not dump it.
Very rich.
Very, very rich in nutrients for the child. Don't dump it. Then after you start expressing this almost whitish milk. Yes. So when you start having milk mixed with yellow streaks and bloody streaks, please, you need to go and seek medical help. Yes. These are some of the signs and symptoms of what we call mastitis. You could even be having an abscess in in a sac that is supposed to keep the milk, which we call the lobules, the ducts. Yeah. So just maybe a take home.
Very true. So as we're closing, people, We are having the Medical Expo. It's an exhibition between 7th September and 9th of September at the Uma Lugogo Showgrounds.
Showgrounds, yes.
The entrance fee is 5,000. People, first of all, people these days, everyone is interacting with who they say these are doctors. People are lying, but then people are lying. Come to the exhibition, get to meet people. You could actually make a friend or two.
Yeah.
Come and talk. It's 5,000 shillings for you to consult
so many people,
different specialities.
So many consultants.
You come in, talk to people, because we are trying to improve medicine in our Uganda. Because honestly speaking, so many things are done with barbaric practice. Not so. Things are done which are like very old, some things are done which are very wrong. And we are just starting. The show is just beginning. We're going to tell you about different practices that we've seen. What questions do you have? What do you want to know? What things have you heard of that are rumors? Then there's also these TikTok doctors passing around information.
The herbalists.
Yeah, so much. And everyone calls themselves doctor, and the patients honestly do not know.
And they latch onto the convincing tongue herbalists and other clinicians so much because they say what they want to hear.
What they want to hear.
And unfortunately, it's going to be detrimental to the patients, and then later they come with very, very complicated diseases at end stage, and you really can't do much for this person, but because they have been misdiagnosed, misinformed, disinformed, treated in the worst way possible. Yeah, so I think what the campaign, because the MedExpo is under a health literacy campaign that is going on for 9 months, and what we are trying to do as MedExpo Africa is trying to increase the health literacy of people in Uganda, first of all. Yes, people are able to make informed decisions about their health. They know where to get what help, where to go, the doctors to consult, you know. So everything is going to be there at the expo. The doctors, the insurance companies, the health experts, talks on stage. So please, come one, come all.
All sorts of things.
Honestly, 5,000 shillings to get a consultation from so many experts.
So many
it's really, really worth it.
Please come, you're welcome.
Yeah.
So we shall be having so many more shows, and you'll be seeing more of us.
Yeah.
Tell us a lot of what you want to know, what you want to hear, what have you heard. People don't even know where to find actual doctors because they go to facilities and they're crooked.
Yeah.
So you're welcome. Thank you so much for watching. Thank you.